Hi, I'm David King-Lassman. This is GigXR, and today I'm joined by Lance Baily from Healthy Simulation. Lance, I just got to kick off. I'm a Brit, so I'll call you Lance, and I know I probably by this stage should be saying Lance, so apologies
No,
for
no,
that.
that's the correct way of saying it. As my mother always tells me, she's English. She immigrated to the States. I was born here in the States, and she complains that people call me Lance and not Lance. And I'm like, well, that's kind of on you, Mom. So no worries. Either way is fine.
So I've known you a while. You've got a great story, and you're an absolute legend in the simulation space.
Oh, thank you.
Uh, I think it would be great to hear a little bit about your past, your background, what inspired you to take the path you're on, and what
Sure.
drove that passion.
Yeah, absolutely. So, I come from a healthcare family. So my father is an MD, and my mother became a nurse and then a nurse educator when I was a child. She actually came to the States herself with a PhD in physiology, but turned to nursing. And so I grew up in kind of a healthcare space. However, I also grew up in Los Angeles, and so the film bug really bit me, and I went for a career in film and digital media production. Went to school for that, got my bachelor's at UC Santa Cruz, and then came down and worked in Hollywood for a bunch of years. Actually got a chance to work with Tom Hanks and his production company, Playtone. So everything from small commercials all the way up to big budget Hollywood filmmaking, and had a great time. But learning a lot in that space about bringing together large number of people for sets and high cost productions, and how does that all come to be. But just kind of felt like in the end of the day I wasn't really helping people in a way that I kind of really motivated and moved me in a really meaningful way. And so I went back to school, became an EMT and a firefighter. And while I was going through that amazing training process, my mom was actually the director of nursing, excuse me, at the El Camino College, the community college in Torrance there, and one of the prominent schools in the space that's doing a lot of great work. And they had a nursing lab with a simulator. And so I walked into the space. I saw this, I think it was a Sim Man Classic. It had all these audio video cameras around, and it just kind of like it was like an aura, like like it just kind of like everything was just like this is it, right? And so it's experiential learning, AV production, healthcare, emergency medicine, and computers and technology. And so, film and digital media in these days, other than the highest, film where they're using actual film, they're going to digitize it all anyway, right? So there's a lot of technology involved in that. And then also teams working together to tell stories. So that worked really well for me when I became a sim tech for the LA Community College District. While I was trying to become a firefighter in the area, I learned about sim tech jobs. I thought they were super fun, and I had my hands full almost immediately helping a lot of different community colleges with their simulation technology operations. From there, I got an opportunity to become the director of the Clinical Simulation Center of Las Vegas for the Nevada System of Higher Education. And so I kind of evolved into a management role, which I think is great to have that technical background to understand, this is really about, in a sense, kind of creating a business model where we can franchise, in a sense, a simulation program so that it doesn't matter which customer, or in this case, which learner is coming in or which learner group is coming in. They have to go through a process of engaging with training. We have to get them out the door, reset up for the next one, right? And so, kind of thinking about how we could kind of improve this new program. We went from 5 staff to 10. It was a complicated process with a medical school and 2 nursing schools. My first managerial role, and so it was a chaotic 3 years. We got through it, but during that time, I just looked at the industry as a whole, and I thought, wow, in this day and age, there really aren't a lot of online resources specifically geared towards helping others like me, either in education, training, or patient safety, to improve those outcomes using simulation-based technology. So, we have a couple of vendor events annually in these international conferences, but not everyone can attend, and they're sporadic, right? So I thought maybe we could build a website that would act as a global resource, to the space. And so I think we had about 30 people come to the website that first month. I think half of them were my mom, who was trying to support me, but we have grown by leaps and bounds since then. They say in Hollywood, an overnight success takes 10 years. Well, last year, we hit upwards of 40,000 unique visitors a month to the website. We doubled in traffic, I think partly due to COVID, but also just our high quality content and our media partnerships with a lot of the nonprofit organizations globally in terms of in-kind exchanges that we help to support them with in terms of advertising. This year we hit 45,000 unique visitors to the website, over 21,000 email newsletter subscribers, and about 30,000 social media followers. So, certainly we've seen a trend of interest increase in the space across all of our various mediums of engaging with the community. But I also started SimGhost, the nonprofit organization that's put on over 20 events around the world in healthcare simulation technology operations, either for those that have a clinical background, say 50% come from a clinical background, the other 50% from a technical background, but bringing them together and allowing them to share ideas, concepts, learning that they've and experiences that they've had, and kind of bring all that together so that we could all walk away with more. And, in my experience, there are very, very, very few people who went through a professional educational degree pathway to gain their simulation-based knowledge, right? We just don't have yet the market saturation to have kind of everyone be trained to the degree that they probably should be with regards to this methodology, and whether it be technology administration or clinical educational outcomes. And so, trying to find ways of bringing groups together who all come from different backgrounds, like I did. I came from AV. Well, at our SimGhost events, we'd have me with 20 years of AV experience and EMT firefighting. Next to me would be, a sim tech, and she has 20 years of IT experience. And next to us, a former paramilitary expert who did a lot of moulage, right? And so if we all come together and start to share these experiences and the knowledge from our own unique backgrounds that brought us into simulation, we can walk away with so much more. So that's always been the kind of the concept and the idea behind a lot of the projects that I've done, but now just really focused on healthy simulation and creating that content that's going to really help people to kind of move the needle as best as possible for their own programs and for their professional development.
Sure. So let's talk about simulation. To the uninitiated, to those who aren't necessarily in healthcare, can you give us a little insight into why simulation is so important to train our doctors and nurses? And let's also think about like the arc of that simulation experience. What did simulation look like back in the day? And without giving too much away about where we're going to go in this conversation, have you seen that simulation change over the course, say, of the last decade or more?
Right. Yeah, absolutely. And so, I think what's really important to consider is that we look first at other industries that have fully mandated and regulated the use of simulation with regards to their education and training outcomes. And I really love, obviously there's the US military, but I love, or other militaries, but I really love pointing towards the aviation space, right? And so 50 years ago, they did not have CRM, or crew resource management, which is their team-based communication protocol, most closely kind of aligned with what you would think about team steps from AHRQ. They did not have black box technology, and they did not have advanced technology simulators, right? And so that meant that there were accidents taking place all over the world that were major incidents that a lot of them ended up finding out that they were communication-based errors that led to, airplanes crashing and people dying. And so that space went through a massive transition to bring in these technologies, generational changes, mandates and support from government after the industry selected to kind of improve these outcomes. Why? Because if a plane goes down, the whole world really freaks out, right? Like it's a really kind of scary experience that hurts the entire industry as a whole. And so you can see like something like the 737 MAX crashes, 2 of them go down. They shut down that airplane for 2+ years to figure out exactly what happened and do, a lot of testing to make sure that it's safe again. None of that is happening in healthcare at this point, right? But that's where we are. We're in the start of our journey, like aviation, into a world that is safety first, right? And so aviation has become one of the safest industries in the world. And with 33,000 international flights a day, yeah, it's important to get every single thing right. An important note there, pilots are making 2 errors an hour, research is suggesting. But because the industry is so focused on preventing those Swiss cheese holes of, 7 errors adding up to catastrophe, they get cut off, right? Systematically designed. And so that's one of the things that we need to think about in terms of our space. Not only is medical error the 3rd leading cause of death in the United States, estimated 220 to 440,000 patients die a year annually. Globally, 3 million estimated die a year annually, but also now COVID, right? And that has dramatically changed the landscape in terms of what we need to think about in order to be successfully kind of dealing with the next potential breakout or global pandemic situation. So we've got a lot of reason to kind of think about these things, including the costs, right? And I think there's a lot of outlier organizations that have really figured out that actually the ounce of prevention is worth the pound of cure. You see a lot of those institutions, showcased through, for example, the Patient Safety Movement Foundation that has its annual summit and its online resources, extremely helpful to the community. I highly recommend you check those out. And just kind of a movement that's taking place in that space that really correlates really well with simulation. So, just finally to kind of like put that into perspective, I think, there's a lot of different reasons why simulation is super important. And for me, having been an EMT, I'd like to point out that I went through my 10-week intensive, summer training course, and not once did I get to experience an OB emergency or a birth, right? And so I was basically, I got my national license. I was in EMT and ambulances and, for a couple of fire departments while I was volunteering and going through that process, but I'd never seen a live birth. In fact, the first one was with my wife about a year ago. And so, it was a big hole in terms of like my direct experience of a clinical outcome. And that's the thing, we have this kind of pyramid, if you will, with at the very, very top, the golden cow of clinical experiences. But I went through my clinical experiences and I didn't see any birth situation, right? Or emergency situation. And so we can't kind of rely on clinical experiences to guarantee all learners will have the same experience, or in fact, that they'll have that experience at all, right? And so I think we really need to be training through simulation the things that are really important that everyone's got to get right, and those things that are just going to be really rare, but that are important to kind of know and witness and kind of be prepared for. Plus, it just gives learners the opportunity to experience what their role is going to be like before they try on those shoes, right? And so in the past, folks were practicing on each other. They were practicing on fruit for IV starts. And it's just like, one, that's not safe. And it's not effective. And also, what are the standard outcomes that we're going to be able to prepare them for in terms of the realities of their position? So there's just countless benefits, lots of research pointing out things like 88% reduction in lethal infection rates from CVC just-in-time simulation training, 7-to-1 cost savings, crazy numbers like 80% increase in knowledge after just one VR experience. And so just tons of stuff out there that's supporting both the profitability of investing in simulation and better outcomes, as well as better patient safety outcomes. So lots of reasons why to think about simulation as being, certainly in line for the same kind of revolution that took place in aviation is going to be taking place in healthcare over the next 30 years.
Sure. And do you see the industry moving towards a place where this simulation is kind of regulated, legislated for? Because all the evidence is pointing to the fact that simulation is vital to driving those learning outcomes and ultimately, decreasing bad outcomes for patients, right? Like improving standards in healthcare.
Yeah, no, absolutely. Without a doubt, it will eventually become regulated and mandated. There's no FAA and there's no NTSB right now with regards to the healthcare space. But I think we're only, quite frankly, a major PR campaign or PR nightmare away from recognizing just how dramatic this issue is in terms of medical errors and what needs to take place to improve those things over time. I think once regulators and I mean legislators kind of are informed about not only the cost savings opportunity, but the standards in terms of what should be expected when people enter into a clinical space, eventually over time that will come to be more and more recognized as a crucial kind of success and component, right? We're seeing, insurance companies get involved and want to reward with regards to healing a patient and keeping them out, right? Not having them come back, which means that quality has to come first and that the outcomes are the driving factor for reimbursement. Well, that is also the case, but with regards to those outcomes, the cost of medical error is estimated to be somewhere around $606 billion for developed countries annually. And that's about 13% of the cost of healthcare is going right back in to solve all of these headaches and these concerns with regards to the after effects of medical errors or issues with, causing patients to have to come back or while they're there in the experience in the space, right? And so if we can offer, hey, what if we invested half of that money and save the other half and get better outcomes overall, right? And I think it's just a matter of time before a lot of different groups start to see that potential. And I believe that you're going to, the types of investments that you're seeing right now into the space, I think partly due to COVID. And obviously there's a lot of outcomes that are going to be changing because of that. We can get to that in a second. But you're seeing like $22 billion invested by the US Army in HoloLens through Microsoft, right, over the next decade. We just saw Labster acquired UbiSim. Labster just recently took a Series C $60 million investment round led by Andreessen Horowitz, one of the leading investment capital arms groups in Silicon Valley. And so that is big money coming from advanced technological kind of forward-thinking investors that took a look at what happened during COVID and realized, oh my gosh, all of the entire healthcare space is not utilizing the available tool sets that exist in other industries or exist, as an emerging industry, like especially VR and augmented reality. And they don't have access to any of it, even screen-based digital learning applications and tools. And they are going to need more and more and more of this stuff. So the Band-Aid's been ripped off. Pandora's box has been opened. COVID has acted as a catalyst. And I think one of the major reasons why is because we have this technology adoption curve, right? And so early adopters, innovators on the front end, laggards, late stage adopters on the back end. Well, during COVID, all the laggards who normally would be able to get away with naysaying, these new virtual learning technologies, remote distance learning technologies, VR, AR, desktop, screen-based, whatever it is, telesimulation, telehealth, they could reject them and there wouldn't be any consequence. Well, now there was no other alternative. We have to do something to get these learners to continue to go through their educational degree pathways, their training requirements, their patient safety initiatives that are focused on the hospital as a whole or medical group as a whole. And so what you found is that, groups started to see, wait a minute, we can save money. We don't have to bring people in for brick and mortar education and training. We have standard outcomes because now we're not trying to invent simulation every single time, or we've got an actual, protocol for each simulation experience that's been, created and approved. So we're getting much better outcomes, and we're getting we're getting reduced costs when it comes to process and evaluation overall. And so, these types of demonstrations that took place, and I don't mean just education and nursing, but I've heard of simulation centers coming on board and being the first group to test and drill out, testing sites or vaccination sites or any of the other chaotic things that hospital groups were being required and forced to deal with. The simulation center was the primary hub for innovation and improvement process during this past 2 years. And so a lot of C-suite executives for the first time opened their eyes to what simulation programs could do. And now that that has happened, I think we're going to continue to see investments in this space, not only to kind of combat just the next pandemic, because that's a concern, but I think more so they've seen, oh, wow, look at what we can do when we think about making these investments in digital-based technologies will reduce those headaches over time. I saw a statistic somewhere, and I could figure out exactly where that came from, but 88% of nursing educators that were interested in or were using virtual education tools during the pandemic are going to keep using those tools or explore more ways to increase and adopt those tools over time. And so, for everything we've been hearing, this is what's taking place, and this is what's going to move and drive the industry moving forward, certainly in a big way.
Right. I mean, yes, COVID, of course, has been transformational. But if we think about simulation, back in the early days of simulation in healthcare, we're very familiar with mannequins and big analog pieces of hardware that required these big bricks and mortar sites where they could be housed.
Oh, I know. I moved some of them around. Yeah.
Right. So let's get to the crux here, because
sure,
with COVID, that simulation wouldn't have been possible without extended reality, right? Now, I know that you're very familiar with virtual reality and a lot of the great products that are out there that are providing simulation tools and content. Mixed reality has opened up a new opportunity. Can we talk a little bit about that and what you're seeing empirically in the market?
Yeah. So I think what's going back to this, golden cow of the clinical experience, well, just below that is going to be our high fidelity simulation experiences, where we bring teams together from different departments or different educational pathways. They come together and they do a high fidelity simulation experience with, one of these high fidelity patient mannequins or surgical simulators, whatever the requirement is. They're all in the same space. We have all these expensive AV systems recording them for debriefing purposes, and yet another room where that debriefing is taking place. So there's a lot of process involved with setup, tear down, coordination, scenario design, faculty education and training. On and on it goes. And so, yeah, these learning opportunities are extremely important, and they are right at the tippy top of this kind of apex just before those clinical learning environments, but very costly and very time, a heavy requirement in order to perform and do them. Well, so now digital-based technologies just really, I would say in the past 5 years, have added this entire additional layer to this learning pyramid, somewhat below that highest fidelity simulation lab experience, but one that does not require us all to be in the same space at the same time, right? So, augmented reality, where we have, overlays of a visual field in front of us where we can still see real life. Virtual reality, where we have a headset and it's an entirely created virtual experience, or mixed realities, where we'll be taking bits and pieces of different elements, perhaps screen-based learning tools mixed with VR elements, or holographic elements, or even mixed reality like simulators, like hybrid simulators, like you might see from a company called Avkin, where they have a wearable simulator for doing various types of like trach procedures on a live standardized patient. We call those simulated patients overseas in the EU and beyond, but in the US, we call them standardized patients, where they're acting out, and role playing as a patient in a way that's standardized so that it's done every single time the same way for each learner that comes through, but enabling for this kind of blended learning approach where we're taking simulators, mixing them with different modalities of learning and training. It's going to provide for full coverage of various experiences that are necessary for clinical professionals to be effective in their roles, right? And so if you have access to digital and remote technologies, then you go into SimLab space, and perhaps, you could even do 360 cameras to orient people to a space before they even get in there. There's all these different ways that we can expand upon the various activities that are happening through the simulation center, democratize the process, open it up to more people to be able to access more content online in their own time. And I think that that's going to be a major, push and outcome from COVID is that we don't all need to be in the same room at 9 a.m. on a Friday. Okay. We can do half of this stuff before we even get there. And then when we do come together, it's because we're doing something that requires a face-to-face, either a skills-based application where you do need hand-eye coordination to learn this thing or to demonstrate or assess this thing, or, with regards to communication. Certainly there are times for that, but there's a lot of didactic or self-learning that can take place off campus anytime that is convenient for the learner, that I think is going to roll over in terms of a lot of institutions seeing, hey, wait a minute, the cost to be here is very expensive. We can get away with half of that being done somewhere else. And that's not just going to happen in healthcare. That's going to happen in every single education and training sector in the world because of COVID. I think it's kind of opened the eyes to a lot of people about what the potential is because they were forced to, right? And so now that they see the light, and they're going to go ahead and start continuing to make investments into that space and in that technology.
So what do you think the impact on some of the more traditional simulation technologies, like high fidelity mannequins and so on, is going to be as we move to a more digital and remote learning environment?
Yeah. So I actually think we're going to still continue to perform those experiences to the same quantity, if not more, as simulation continues to demonstrate its value to various institutions and to professionals. But there's this new layer of, XR and all the things that go in it that now exists, right? Well, somewhat below that in terms of like, the fidelity-ness of it actually happening in real life, but also opening up the ability to kind of learn a lot of these clinical processes over time. And so to me, I think what we're seeing is that while people are going to still want to keep that apex high fidelity simulation lab experience, they're going to expand into a completely new areas to augment that and complement that high training experience with additional learning resources that are going to make those ones even more effective. But, it really should not be understated. The cost and the time involved in producing those types of outcomes still really relevant and important. I think we're going to see more of that, but even more so, we're going to see, I think, a 10x increase when it comes to at least least in the next 5 years when it comes to that kind of new layer of XR technologies in the space, furthering help support the entire learning pyramid.
Well, I mean, you are at the vanguard of what's happening in the technological field around simulation. You know, you talk about the next 5 years. What do you think we're likely to see? You know, if you could let your imagination run wild, you know, how far is this going to go?
Yeah. And so I think what's really exciting again is those investments that are coming into the space. You know, several groups taking large rounds. Applied VR just took a $29 million series, I think it was Series B round. And Verdi took a $10 million round. Health Scholars took rounds recently. So a lot of different groups are going to. So I think over the next 5 years, I think, you know, a lot of eyeballs from capital investment groups are going to be looking at the clinical simulation space and realizing the huge opportunities that exist in a space that's quite honestly fledgling. I mean, we're probably at a 10% market penetration at this point, and that's in developed countries only, and even then to varying degrees of utilization depending on the institution as a whole. And again, like if we're looking at taking away of the parts of that $600 billion a year problem with regards to medical errors and miscommunications that are taking place, it's only a matter of time before a lot of groups start seeing the writing on the wall. Again, innovative leaders and outliers like MedStar, for example, which, you know, has a lot of showcase kind of patient safety outcomes, again, through the patient safety movement. You're going to start to see investments come in. You're going to start to see C-suite executives learn from COVID and also see what's taking place in terms of the opportunities. And also you're going to continue to see technological developments, which are going to completely revolutionize the space. The reason why I said 5 years, really just in the past 5 years as this space really started to take off, is because of the massive investments by major international corporations into the hardware. So Facebook acquires Oculus, and now they have just named themselves Meta because they understand where this is all going, which is into completely digital universe where all kinds of things are interconnectivity happening between various organizations, people, institutions, all online, right? And so because of that kind of investment, it's led to you know, Microsoft and the HoloLens is a technological investment. I know that you had Eric on recently, great podcast with him, learned a lot about what they're doing. I thought it was really remarkable. But, you know, those types of hardware investments are going to free up groups like GigXR and others to focus more on the software and the content and developing tools that work with those pieces of hardware. And so because of this investment at a major scale, it's in a sense helping us in the clinical education space to have access to these tools for the first way in a really meaningful way. 10, 15 years ago, VR was like you'd have to wear a computer on your head and you had to have balance support and wires everywhere. Now, if people have not recently put on a HoloLens 2 or a VR headset like Oculus Quest 2, do yourself a favor next time you have the opportunity and do that. It's insane how much the quality has improved digitally and the potential with the hands and the wands to engage with your environment. And this is only the beginning, right? Moore's law says that we're going to have a doubling of computer power. It's not linear, it's exponential. And so as these technologies continue to increase in capability, reduce in cost, I mean, imagine the headsets we're going to have 5, 10 years from now. They're going to make the current tools look obsolete, just as all technology does, right? I'm not using an Apple IIc for my desktop publishing or for watching movies or even connecting to the internet anymore. And so those things, you know, there's this natural progression, which I think is going to continue to increase the affordability of the technologies. The graphics are going to get better. And groups like GigXR are going to showcase real success stories that others are going to learn from. On top of, you know, what are these litigators going to see or legislators going to see, excuse me, in terms of what the opportunities are to improve outcomes, and investors are all going to come in. And this is just going to make a very frothy space that's going to go ahead and have, I think, a major increase in terms of adoption over the next 5 to 10 years, partly due to COVID. But, you know, it's unfortunate it takes a global pandemic, but, you know, that's the outcome, forcing people into a box to make decisions. And the outcomes that will come from that will be dramatic, in my opinion.
Well, I think COVID has demonstrated to us that we can learn in this way. We can experience amazing outcomes being remote. And you mentioned it, that statistic of 88% of nurses going to carry on learning remotely. We're definitely seeing that empirically from the customers that we're talking to, who's saying, hey,
Yes.
we were forced to do this. It worked. Our costs come down. Our outcomes go up. Everything's happy. Everyone's happy. So let's talk about you, Lance. Like, where's healthy simulation going? What are you doing? What's the next innovation coming out of your entrepreneurial spirit?
Well, thanks. Yeah, I can't seem to stop creating new things, right? It's a double-edged sword. It's a slave to it. But so, we at Healthy Sim, we saw a doubling in our website traffic last year, partly due to COVID, but also just, people are finding us on Google through a lot of our content over the past 10 years. And those media partnerships with groups like Anaxel or Sesam in Europe, ASPE in the UK, where we're helping support those organizations and they're helping to showcase and share what we're doing. But in terms of, the latest and greatest from Healthy Sim, we've worked really hard to create a new LMS platform, learn.healthysimulation.com. Over 100 recorded webinars there already available, many of which have CEs through the California Board of Registered Nurses. And then as well, a lot of free content, and courses as well. So we've really kind of helped to kind of expand into supporting groups with webinar presentations and courses, CE content through the Learn platform. Well, we've been focused on, really covering what's going on with COVID, but also these dramatic, opportunities that are taking place in XR in terms of these investments and what's going on in the space. For us, I think we're going to continue to expand into more video production opportunities to kind of get more interviews and content out there from experts around the industry and the world and the community to share what's going on in those spaces. But, for us, it's really about being kind of, in a sense, an online trade magazine for the space, helping connect people who are looking for specific technologies or research or organizations to help move the needle for them, for their own professional development or for their organizations to continue to improve upon. And one of the things that I think it's really important that, I'm working on through Healthy Sim for myself is finding new ways of bridging partnerships between entities and groups that aren't saying the same thing and have the same goals with regards to patient safety, simulation, medical devices, anything and everything that might be a touch point for training through simulation in terms of other organizations out there. So, I think it's going to take a coalition that really understands the problem, and then we'll be able to communicate that problem not only to the general public, but also to legislative groups globally about what the opportunities are. And so I think that there's going to be, I think more coming together from patient safety, medical devices groups, simulation groups, groups that care about, quality improvement, performance. And so bringing that all together in a way that's going to move the industry further in a new and big way. And that's one of the things that I'm really trying to focus on about trying to find partnerships in ways that Healthy Sim can be a bridge between other, various groups out there and expand the conversation in a way that's going to impact the industry as a whole. So, excited about, helping to do that with groups like GNSH, the Global Network for Simulation in Healthcare, is a kind of a think tank where leadership of various nonprofit organizations and commercial vendor partners come together and they try to solve problems. They've got a new 30-minute weekly simulation initiative that they're working on. And I know that, for example, we put them in touch with the Patient Safety Movement Foundation and other groups to try to help expand these opportunities to think about this. Because it's crazy. If you go in the patient safety meetings or conferences like IHI or, which now I think runs the National Patient Safety Foundation or the Patient Safety Movement, they're literally all saying the exact same things that we're hearing at simulation conferences and events or virtually, in the past 2 years. And so trying to build bridges between these groups that are saying the same things is part of the goal of what we're trying to accomplish most in the space right now.
Right. Well, Lance, it's been fascinating listening to your insights. I dare say we could go on all day.
Oh, all day.
but I think probably it's worth bringing this to a close. I'm sure I'll see you in LA for IMSH in January.
Absolutely. Yeah.
And in the meantime, have a great holiday period. Stay safe out there. Thank you for the contribution that you are making to simulation and to tech companies like ours, spreading the word. We're really appreciative of everything you do. Thank you so much. I'm David King-Lassman. This is Explore XR. Have a great day.